Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Welcome to the 27th episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And I am so excited to welcome back Dr. Zisman to the podcast. If you haven't already listened to episode 17, that is a really good one. That's definitely worth going back and listening to. In that episode, Dr. Zisman and I talk all about how kidney stones really are preventable and how passionate both of us are about getting that message out into the world and helping people work with people and coming up with truly a personalized kidney stone prevention plan. So that's really a good one. And again, very much worth your time. And I am excited to have her back to talk more about your kidney stone medical team. I felt like this was a really good topic since many people with kidney stones only work with a urologist when it comes to stone everything. And, maybe that's not enough. And so today we're going to be talking about some of the other members that you might want to incorporate into your kidney stone team, including a registered dietitian like myself, and why that could be so important and sort of the pros and cons of expanding your team of medical professionals when it comes to kidney stones. So if you haven't listened to that 17th episode, I did want to talk a little bit about Dr. Zisman because it really is really fantastic that she took the time to talk to us on the kidney stone, on the Eat Away Kidney Stones podcast, because she really is a pretty big deal when it comes to kidney stone prevention. So she currently is the director of the stone prevention program at the University of Chicago. She did her medical school went to medical school at the University of Wisconsin and came back to the University of Chicago to do her fellowship in nephrology, which is where she really sort of honed in and really dedicated her career, honestly, to stone prevention. Since then, she continues to work at the University of Chicago, where she's now the director. She has published extensively in stone prevention. She is a member of the ROC Society, which stands for Research on Calculus Kinetics, which is a society of kidney stone researchers that come together twice a year to, share the most recent cutting edge research when it comes to kidney stones, and a lot of it focuses on kidney stone prevention, which, as we talk about today, many doctors are maybe not necessarily well versed in. It really is a surprisingly small community when it comes to stone prevention. I could go on and on about all the wonderful things Dr. Zisman has already done in her career, but I don't want to waste all of our time, and I'm excited to get to our interview where we talk about your kidney stone medical team. So let's welcome Dr. Zisman back to the podcast. Welcome back to the podcast, Dr. Zisman. I'm so excited to have you again.
Thank you so much for having me back. This is exciting.
Yes. If you didn't catch our previous episode 17, we talked all about how kidney stones are preventable. And we dove into all of the things that you can do to prevent stones, the testing that you need to do, and how your message that you want to get out to the world is really just that kidney stones are preventable. And I love that message. It makes me happy.
The more people hear that message, the happier I am as well.
Yeah. And I know that
for having me.
Yes. Yes. Happy to have you. And I know that podcast brought up all sorts of questions about how do I see a doctor like you? Not everyone is in the Chicago area or in Illinois. There's people honestly all over the world that are listening to this podcast. And so I thought that it would be really great to have you back to talk about what your kidney stone medical team might look like and how to curate a perfect kidney stone team for you. So let's just kind of start with the basics. What kind of doctors and other healthcare professionals might you work with in terms of your kidney stone care?
So the team, in general, you want a multidisciplinary team helping you prevent your stones. So the two main doctor types that deal with kidney stones would be a urologist and a nephrologist. So a urologist is a surgeon. They're the folks that will go in and help you get rid of a stone that's blocking or a big stone that's growing in your kidney. They're the ones who can immediately alleviate, an acute problem. The nephrologist, unfortunately, can't do much for that obstructing stone. But what we can do is help you prevent a new stone from forming. Uh, we take a long time to spend with our patients to get into their medical history to figure out why they're forming stones and make sure that people are in an optimal regimen to prevent that from happening again. Uh, so both urologists and nephrologists are certainly able to do stone prevention. I think in general, the urologists are quite busy in the operating room, and that's where their focus is, which is why I think it's really important to have both types of doctors involved if you're a kidney stone former. And then we get to the rest of the team, which is just as important. Perhaps nobody can be as effective in helping you prevent stones as a dietitian, because nutrition is just such a key component of stone risk factors for stone formation. And the team, those three pieces of the team are critical. Now, each of the offices that you might be seeing might have a nurse practitioner or a physician's assistant that's part of the team. And these folks are often incredibly skilled in helping you identify the problems and target the prevention.
Okay, so it seems like the two main doctors are that urologist, which is always a surgeon, correct? Is that
Correct.
right? Okay.
They
And
might not
then
always operate, but they are capable of operating.
got it. And then also a nephrologist. So kind of what is the training difference? Like what, in addition to stones, what else might a urologist and a nephrologist treat?
Yeah, so a stone prevention or stone treatment are small subsets. They can be areas of specialization for both a nephrologist and a urologist. But as you mentioned, that we are very different in terms of how we get to this point in our careers. So, of course, both a urologist and a nephrologist go to medical school. And then after medical school, a urologist goes on to a urology residency. And a nephrologist first has to do an internal medicine residency. So your general internist or your nephrologist could also have been is prepared to have been a general internist. So we do our internal medicine residency, and then we do subspecialty training in nephrology. On the urology side, the general, some of the stone some of the surgeons out there, some of the urology surgeons out there are just general urologists. And then there's a subset that's subspecialized further, and they're called endourologists. And those are people that really focus on the stone. Pretty much all they do is stone disease. Other diseases that both of us or that each of us would treat. So urologists will do everything from incontinence, prostate issues, kidney cancer, pretty much anything having to do erectile dysfunction, anything having to do with that system. On the nephrology side, we focus obviously on the kidneys. Nephron is Greek from kidney. And the diseases we treat are multifactorial or multiple. So glomerular nephritis, so inflammation of the kidney for a variety of reasons. Kidney disease from high blood pressure or diabetes. We do dialysis when kidneys fail. Kidney transplant. So after a surgeon puts a kidney in, we can take care of the after the transplant. So very different paths, but we meet in the middle on stones.
Yeah. I learned something today. I didn't know how a urologist becomes a urologist. I actually didn't know that at all. So thank you for educating me.
Yeah.
Okay, so it sounds like obviously nephrologists and urologists treat a gazillion different things. And it seems like in my experience, pretty much everyone who has stones, basically everyone who has stones, is going to have a urologist, because they're the ones that are really kind of monitoring a stone that might have formed and monitoring you for any new stones that might form in the future. So certainly people tend to have a urologist, but having a nephrologist for stones isn't as common. Would you say that everyone who has had a stone or who has more than one stone should also be seeing a nephrologist for kidney stones too?
So, 100%. So, there are some urologists out there that are very, very good at doing stone prevention. And if that's happening, that's fantastic. In my experience, again, it's not that they can't, but it's just that they are very, very busy with the OR and a very busy practice surgically. So certainly anybody who has had recurrent stones should absolutely be seeing a nephrologist to help prevent kidney stone formation in the future. If you've had one stone, I would just advocate, whoever you're seeing, that they do a 24-hour urine collection so that we can identify, the risk factors. And oftentimes what can happen is urologists can order that collection and then they get it back and they might see some surprises that they don't know quite what to do with. And at that point, sometimes we get the panicked referral saying, I don't know what to do with this. Here, you guys figure it out. And we are delighted to
Yeah. Um, all right. So if you're really, really interested in prevention, it sounds like getting a 24-hour urine test is critical. In many cases, your urologist might be able to handle whatever's going on in that urine test. I know on a previous episode, I talked to Dr. Prohaska about some of the same stuff, and we talked about how there was, if you get your 24-hour urine test through a company called Litholink, they have some analysis or some suggestions for both your doctor and you as the patient, for what to do about it. Correct me if I'm wrong. I actually can't remember if that's true, but definitely some advice for the doctor.
So historically, that's been true. So when you get the report, you get everything. I am being told that they're actually modifying this
Oh, okay.
going forward to where it'll be practice dependent. So I, as the doctor, can decide if I want those interpretations to be released to the patient. Because I think
Interesting.
sometimes it can cause some confusion.
And some
Um,
unnecessary panic inside.
Exactly, exactly. They have not come around to asking me yet what, uh, but the rumor I have heard is that that's what they're headed towards.
Got it. Okay. Interesting. Interesting. Insider scoop on the 24-hour urine test.
Yes.
um, but so basically, I was saying if you want to prevent stones, you have to get this urine test, and likely your urologist is the one that should be ordering this for you always. But if you then need to sort of have escalated care, you're a bit more high risk, then adding a nephrologist to your team would be a good move.
I think it is geographically dependent. There's some communities where, the it first goes to the nephrologist. It depends on your practice pattern. So here at the University of Chicago, we have such a multidisciplinary team that we have a distribution of labor. So, the urologist does not order all the testing because they know that we will, and we take care of that. It just my I would advocate that whoever is taking care of you, just make sure that they are invested in prevention as much as in dealing with the acute issues.
Yeah. Yeah. So I get many messages per day from people asking about this 24-hour urine test, since I do talk about it so often, and saying that their doctor hasn't ordered it. And I have some tips. I'll put that in the show notes, my tips to ask your urologist for a 24-hour urine test. But how can you sort of know if that urologist is going to be able to interpret that 24 urine test? Basically, how can you know if your doctor really is invested and well educated in terms of kidney stone prevention?
I think that's a really hard question. So I think I would say if you're having to ask for the 24-hour urine test to be ordered, I might think about expanding your team to include, the nephrologist, who might be a little bit more, again, more interested in the preventative side of things.
Mhm.
Um, the I think Um, in general, the you can look for to see if people, the endourologist will definitely be a little bit more versed in interpretation of the 24-hour urines because they've been exposed to so much stone disease.
Yeah.
But just like it's individual. Each physician will have their own practice style,
Yeah.
uh, and you just want to make sure that you're getting what you need within that.
Mm. Yeah. I really wish there was a stone certification or something that
That's
that
a good
people
idea.
would be able to look for. Because it really is a challenge. I'm not quite to your point.
Yeah.
That was sort of a targeted question because I wanted to learn myself. I don't quite know how to direct people to find either a urologist or nephrologist for that matter, who is well versed in stone prevention. So maybe that's your next
That's
project
I
is
like that. Maybe
getting a
I'll have to think about
certification.
how to make that happen. I mean, I will say so if you look at large academic medical centers, the academic medical centers will generally have somebody who's well versed in stone disease and specialized, right? So at big university centers, there will be the urologist who only does cancer, and there'll be the urologist who only does erectile dysfunction or prostate, stuff, prostate biopsies, and there's just a distribution of labor in the bigger centers. Now, it's not possible in some of the smaller communities. Doesn't mean that they can't take excellent care of you, but just sort of being aware that not everybody will have had the same training.
Mhm. Yeah. Do you think it's fair to ask people could just ask their doctor like before as you're trying to find say you've decided that you do want to add a nephrologist to your team? Do you think that most doctors would be receptive to a patient asking? Do you specialize in stones or do you feel comfortable managing stones?
I think it's absolutely reasonable to ask, are you comfortable managing complicated stone disease patients, for
Hmm.
example?
Yeah.
Uh, Yeah,
Yeah.
I think the hope is that every board certified nephrologist can do this. I think just like anything else, there's going to be variability, and you just have to find somebody who you're comfortable with, and is again interested in prevention.
Mhm. Yeah, absolutely. And I do think that this is one of the wonderful potentials of telehealth. Is that know that at the University of Chicago, for example, you can see people from all over the state of Illinois. And correct me if I'm wrong, they may not necessarily have to travel all the way to Chicago if they live in Southern Illinois, for example.
Absolutely. And actually, during the pandemic, if there was any upside, we were able to see people across the country. You know,
Temporarily.
Yes. Uh, Unfortunately, that is no longer the case. There are a lot of groups working and lobbying government officials to make that happen. But yes, I can see anybody in Illinois. They don't have to be in Chicago virtually, and any of the University of Chicago providers can do that, both for urology and any physician can do this. I will say we also have people fly in from all over the world to come and get you know, specialized opinions,
Mhm.
and hopefully that's not necessary for your listeners. But if for the more complicated cases, we're happy to see people from wherever.
Yeah. And definitely keep in mind other big academic centers in your state, right? Because I feel like, I don't know if this is true, I don't have data to back it up, but I feel like most hospitals are still continuing to do telemedicine in some capacity. So, if you live in California, but you're not close to Stanford, I know that there's a stone program there, like they might be able to see you. I'm just calling them out for some reason. But just kind of don't discredit them just because that you're far away. Like you very well might be able to see the doctors. Maybe you have to go there once or maybe not. Just kind of reach out and see what their protocol is in terms of telehealth.
Absolutely. Absolutely. And yeah, the stone community is fairly small and tight. So if reach out and ask, who the stone docs are, people know.
Mhm. Yeah, absolutely. I was speaking with someone about maybe putting something on my website. I think that would be an amazing resource to people of all of the stone prevention programs nationwide. So maybe reaching out to doctors that are part of the Rock Society, which is
Yeah.
for people, it is a super nerdy kidney stone scientist club, basically, where all of the kidney stone prevention experts kind of gather and share research. So it would be really, really great to have a place where people can kind of go to see where they might be able to find a kidney stone prevention specialist.
I like that idea. It'll be the Melanie stamp of approval for
Yeah,
kidney stones.
Melanie
I
approved
love it.
doctors.
Yes.
Say, I definitely recommend the University of Chicago if you happen to live in Illinois or Indiana still.
Yep. A number of us are able to see patients from Indiana. So I have my Indiana license, for example. Yes.
Okay, perfect. Because I know that during COVID there was reciprocity with licensure, but that ended, it sounds like.
Right. So that ended. It used to be for the entire country, but at this point, you have to get licensed in any state that you're going to see patients. So, which is because University of Chicago is so close to Indiana, we a number of us have gotten our Indiana license.
Yeah, when I worked at the University of Chicago, I still live on the north side of the city, and there was many people who lived in Indiana who had a shorter commute than I did.
Yep,
to
for
head
sure.
all the way up to the north side of Chicago.
Yeah, we
Lake
definitely
Shore.
draw a lot of people from Indiana, which again, for that reason, because we wanted to be able to continue to offer telehealth.
Yeah, absolutely. All right. Well, do you have any other final thoughts about your kidney stone team, finding an expert, kind of tips for making sure that people are getting the kidney stone prevention care that they're looking for?
I would say just reach out to people who are in the know. So whether that's your large academic medical center in your community, Melanie, or whomever. Just if you feel like you're not getting the kidney stone prevention, if you feel like your doctors are not addressing it, push harder.
Awesome. Love it. All right. Well, thank you again so much for being on the podcast. We hope to have you again sometime.
Thank you so much for having me. This is great.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.